emergency, some kind of accident happens, it is to immediately take the person to the hospital. So that should happen. We have to take the person to the hospital. But before that, there are certain things which you have to do. That is what we are going to learn today. Now, when a person stops breathing, within 3 minutes, their heart will stop working. And then within 3 minutes, the person will die. So we only have 6 minutes to save this person's life. That is the very important part of this. So when a person stops breathing, they don't get enough oxygen. So then the heart doesn't pump enough blood. The brain won't get enough blood. So then within 3 minutes, within another 3 minutes, this person will die. So that is why we have to give the first aid first and then take the person to the hospital. Because we take more than 6 minutes to travel. Especially now with the traffic and with so many vehicles, it will take more than 6 minutes to travel. That is why we have to do the first aid and then take the person to the hospital. Now, in any emergency situation, there should be a way how we approach the individual, right? So we'll assume that you're just walking on the road and then there is a person lying down, right? So you don't know what has happened to this person. Sometimes this person must be just sleeping, relaxing, or this person might have fallen from a tree, right? Or else a snake might have bitten the person. We don't know what has happened. So there is a way how you should approach this person. First of all, you have to make sure about your safety, right? So you can just look around the person and see whether, now if he's near a tree, you can just look whether any branches are going to fall, right? So likewise, you can just look and make sure the place is safe. Then you can first verbally talk to the person, right? You can ask, hello, need help, right? You can ask, udav avashyada, you can ask. Then you can go near the person and give them a physical command. You can ask them to move hands, open eyes, just give them a physical command. Still, if there is no response, then you will have to touch the person. So basically, you will have to tap their collarbone twice. So we ask you all to tap the collarbone because it is a very sensitive area. So then if the person is slightly conscious, they might respond. So you have to tap the collarbone twice. First, you have to verbally ask, right? Udav avashyada, do you need help? Then you can give a physical command, attusanna, asarinna. You can give move hands, open eyes. Then no response. You can tap the collarbone twice. Still there is no response. Now you know that something is really wrong with this person, right? So then you will have to check for A, B, C, right? You will have to check for A, B, C. So we'll look into what this A, B, C is. Now, A stands for open airway. So the person should have an open airway so that they can breathe properly. B, adequate breathing. They have to breathe well so that they can take enough amounts of oxygen into their lungs. C is adequate circulation. They have to have their heart beating properly so that blood will be circulated around the body. So as a first aider, you do this to increase the chances of saving a person's life, right? And to reduce the risk of getting disabilities. Because especially if the brain doesn't get enough oxygen, there is a higher chance where you could get a disability. That is why it is very important. If a person is not responding, you have to quickly check for their A, B, and C. Now, when it comes to A, what happens is when a person is unconscious, their whole body is unconscious, including their tongue. So then their tongue is also unconscious. So what happens is the tongue falls back and it will block this airway. So then the person is unable to breathe. So actually your own tongue will block your own airway. So then you won't be able to breathe. That is why as the first step, what we do is we use this double V technique. And from one hand, you can hold the forehead. Then from the other hand, you can hold the chin. And you have to move the head backwards. Then the tongue will fall back into its right place and the person has an open airway. So they will be able to breathe. Then you can use the other hand for the next step. Right? So that is why we do. So the person is unconscious, tongue is also unconscious. So the tongue falls back and blocks the airway. That is why as the first step, we use the double V technique and move the head backwards so that the person is having an open airway. Then we have to check for their breathing. What you can do is you can take your hand, especially it's easy if you take 2 fingers, and like this you can keep it near their nose. Then you can feel whether the person is breathing or not. If you feel like that is kind of difficult, you can maybe keep your ear near the person's mouth and then check at the same time. You have to see whether the chest is moving up and down, right? By those 2 methods, you can identify whether the person is breathing or not. And then you have to check for their pulse, right? So then you can use your 2 fingers, the index finger and the middle finger, and you can keep it near the side of the neck, right? So don't use your thumb because then you might feel your own pulse. So you can keep the 2 fingers like this and examine the pulse. So you have to do both of these within 10 seconds because you know you have a limited amount of time. So first of all, you have to open the airway, then check for breathing, then check for the pulse. So that is what we do from A, B, and C. Now we'll move on to the next part, choking. So have you heard about choking? Do you know what happens when a person chokes or why a person chokes? Do you have any idea? What happens when a person chokes is their airway gets obstructed, right? So that because of some foreign body. So this is very common in children. Children, they usually try to put pieces of toys in their mouth and then they try to swallow it or something and it gets stuck in their airway. So then they will be unable to breathe. So you can recognize a person choking when they are unable to speak, breathe, or when they are unable to cough, or else if they are turning pale blue in color, right? They will be grasping for air. They might also lose their consciousness. These are the signs for choking. So usually adults, they usually choke on pieces of food. So you can recognize a person choking by looking at these signs. What happens is, you know that you can breathe in from your nose as well as from your mouth. So now if you are eating something, it will go in like this. And if it gets stuck somewhere here, your whole airway is blocked. Because even though it comes from your nose and your mouth, both of these get into a single tube. And then only it goes down into your lungs. So if something is stuck in the middle, your whole airway is blocked, then air cannot be passed into your lungs. That is why you start to grasp for air. So then immediately you have to provide ABC to this individual. Now we'll think you all are eating in your cafeteria or your canteen, and maybe your friend or the person next to you starts choking, right? All of a sudden they start choking. Then what are you going to do? What is your response? What are you going to do if your friend is choking? What are you going to do? So now this person will be very scared and they will be in a panic mode. So you have to calm them down. You should also not get scared, and you have to calm the other person also down. And the first thing you have to do is you have to ask the person to bend and cough. That is the first thing you have to do. Ask the person to bend down and cough. Then sometimes the foreign body which is stuck will fall down. But still, if it doesn't come out, if it is not removable, then you will have to give back blows, right? So you can ask the person to bend like this, and you can hold them from their abdomen. And from the other hand, you can hit their middle part of the back, right? So you can hit continuously for 5 times, right? Continuously for 5 times, then you have to stop. Then again, you can hit for 5 times. So 5 times continuously. So if you hit properly in the correct technique and the correct way, within the second or the third time, the foreign object will fall. So remember, if a person is choking, first ask them to bend down and cough, then give them back blows. So since there are other people around, you can ask someone to call the ambulance or call for help. And until that, you can do this. So then still if it doesn't come out, you will have to check for ABC, and most likely you will have to give CPR. And while giving CPR, you will have to take them to the hospital. That is what you have to follow when a person is choking. Now, let's move on to the next part. CPR. So now you are checking a person's ABC. When you check for breathing, the person is not breathing, right? The person is not breathing. You check for C, but C is working. Person is not breathing, but the pulse is working. Then you will have to give them artificial ventilation, right? So if you have a pocket face mask like this, you can use it. Then you have to just blow in air, or else you will have to give mouth to mouth breathing. Then you will have to hold their face like this, and you will have to close their nose, and you will have to blow in air. You should close the nose, or else the air you blow in will come out. So you have to close the nose and you have to seal your mouth and blow in air. So that is how you have to give artificial ventilation, right? If the person is not breathing, but their pulse is working, then you have to give mouth to mouth breathing. Now, you're checking for ABC. B is not working, they are not breathing. C is also not working, right? So that means the person is not breathing and the heart is also not working. Then you will have to give external chest compressions, right? You must have seen this. You will have to give external chest compressions and also mouth to mouth ventilation. You have to give both. So you can kneel down near the person and lock your hands, right? And you can give the external chest compression. So you have to give 30 external chest compressions. And then you have to give 2 mouth to mouth ventilations. So in case if you feel like you can't give mouth to mouth ventilation, if it is especially a stranger, if you feel a bit unpleasant or something, at least give the external chest compression, right? At least give that, because something is better than nothing, right? It is up to you. You have to decide whether you're going to give both or not. If you feel like you can't give the artificial ventilation, at least give the external chest compression. So this is what you have to do if a person is not breathing and their pulse is also not working. Now you can find the place where you're going to give the chest compression like this. You can use both your hands. Keep one index finger at the start of the rib cage or where your collarbone is, and the other index finger at the end of the rib cage. Then you can keep the thumb in the middle, and you can find that is the place where you have to give the chest compression, right? So like this, you can kneel down near the person and you can find the place, lock both hands, and you have to give the chest compression. So you have to give at least 100 per minute. Now, this is the summary for CPR when it comes to an adult, right? So it changes when you do it for children, it is different. But here we are focusing on the adult. So when you're giving CPR for an adult, you have to start with the external chest compression, right? You have to start with external chest compression, and then you have to give 2 artificial ventilations, again 30 chest compressions, 2 artificial ventilations, 30 chest compressions. Likewise, you have to give it. So usually, usually you can do it maximum for 2 minutes, because this is something very tiring, right? It is not easy to do it. So you will have to do it. You can maximum do it for 2 minutes, and then you can give it to someone else, right? You can get help from the others. So this is what you have to do. And you have to give minimum 100 per minute. So, and the other thing is you have to count it like this.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6,
That
7,
is how you have to
8,
count it. You
9,
have to count it
10.
1 to 10. And also that is the rhythm in which you have to give the external chest compression. So this is what comes under CPR. So for this, actually, you need the practical training. It is not easy to just look at the slide and learn it. But with the current situation, this is what we'll have to do. Now, let's move on to fainting. So, do you know what happens whenever, like the reason for fainting? Why do people faint? Why do people faint usually? So when a person faints, one thing is their posture changes. They won't be standing straight, right? They will fall down, right? They can't be standing straight. And they will also lose their consciousness, right? They will change their posture and they will also lose their consciousness. What happens in fainting is it is mainly because lack of nutrients to the brain. So if your brain doesn't get enough amounts of oxygen, then you will faint. Or else if you take something like some chemical or some poison, right, then also you might faint. Or else even if there are changes in blood pressure, high levels or low levels of blood pressure, then also sometimes you might faint. So the main reason is if there is not enough oxygen and glucose to the brain, you will faint. So reasons are usually if you don't eat, right? If you miss your meals, right? Some people, they don't have their breakfast, then later they faint. Or else long standings, right? Children in assemblies, they faint when they are standing under the hot sun for long periods of time, they faint. If you're very tired, if you're exhausted, you might faint. Then dehydration, heat exposure, if you're under the sun for long periods of time, you might faint. And also heart attacks. So these are the common reasons for a person to faint. Now, if a person tells you that they are feeling faintish, right? Mata kalante wage කියලා, if someone tells you, in which position are you going to keep them in? Are you going to keep them in position A, position B, C, or D? At least try to answer this. In which position are you going to keep them? Okay. Now, when a person faints, you have to keep the head in a lower position, right? That is the main thing when it comes to fainting. So if a person is sitting on a chair, right, like in this picture, you can ask them to keep their head on their knee. Then the head is in a lower position, blood will flow into the head. Or else, if the person is lying down, you can elevate their feet, right? You can keep a chair or a stool or maybe bags or something, and you can elevate the feet. So then again, blood will flow to the head. Then the suitable place, right? If the person is under the hot sun, you can maybe take them to a shade, or if there are a lot of people around the person, you can ask the others to move, right? You can form a suitable place. Stand up gradually, right? So you have to ask the person to slowly stand up. Once they say that they are feeling better, you can first ask them to sit straight and then slowly stand up and slowly walk. If the person is fully conscious, you can give them a cold drink, right? If they can take it to their hand and drink it on their own, you can give them a cold drink. So you can check for maximum 30 minutes, right? Within 30 minutes, if the person doesn't recover, you will have to take them to the hospital, right? Within 30 minutes, if the person doesn't recover, you have to immediately take them to the hospital. So the main thing in fainting is you have to keep the head in a lower position. right? After that, you can do the other things. You have to keep the head in a lower position. That is the main thing. Now, let's see how can we control a bleeding, right? We'll assume that y'all are working in a lab or somewhere and maybe a knife or something gets stabbed on your hand and now you're bleeding, right? So how can you control the bleeding now? First of all, you have to compress, right? You have to give a compression. So you can take a clean piece of cloth or maybe a piece of gauze or whatever, and you can keep it on the wound and you can apply a slight pressure, right? You have to compress, give a compression. Then elevation. You have to elevate. Now you can keep your hand above your heart level. Then you can apply ice. You can keep something cold so that the blood vessels will constrict, narrow down, and then the bleeding will stop. Also, if there is something stuck, right, maybe a piece of glass or a knife or whatever, you should not remove this foreign body, right? You have to keep it as it is unless it falls. You have to keep it like that because you don't know how far it has gone in. So don't try to remove it. Just leave it as it is. And also don't try to clean the wound inside and all. You can just clean it from the outside. If there are any, dust, sand or any chemicals or something, you can just clean the wound from the outside. So mainly you have to identify. First identify there is a wound and bleeding is happening. Then you have to stop the bleeding, right? To stop the bleeding only, you have to first compress, then elevate and apply ice. Then you can check for ABC for vital safety and take the person to the hospital. And also you have to remember that you should not get yourself contaminated with another person's blood because there are blood transmitting diseases, HIV, AIDS and all. So you should not touch another person's blood, right? It is better if you can wear gloves when you're dealing with something like this, right? So this is how you can control a bleeding. So you can apply dressings in these ways, right? You can maybe you can use a gauze or cotton wool like this, right? And then you can use some tape. If you don't have these things, you can use a clean piece of cloth or a clean serviette, right? Or else you can use a bandage. Whatever available, you have to use, right? Whatever suitable and whatever you have to use. So these are some ways in which you can apply dressings. Now, let's move on to the next part, shock. So if a person is going through serious bleeding, right? If they are bleeding a lot, they will undergo a state of shock. So when this happens, the person's breathing rate will increase, right? They will try to breathe fast so that they can take more oxygen. Their heart rate will also increase, right? The blood now, you're losing blood now, so the heart will start working fast because it needs to pump a lot of blood. The skin will turn cold and pale in color. You might turn pale bluish in color. And also the consciousness will reduce. The person might feel thirsty and they might, feel a bit nausea as well because they are losing blood. So bleeding can happen externally, right? Where you can see the wound, you can see bleeding, or else it can happen internally as well. Internally is a bit complicated because you can't see the wound, right? But externally is easy to identify because you can see the wound, you can see the bleeding, then easily you can identify the person going through a state of shock as well. When a person is going through this shock, first you have to control bleeding. As we mentioned it earlier, you have to control the bleeding in that way. Then you have to keep the head in a lower position so that blood will flow into the brain. Right? You can keep a chair like this and elevate the feet and allow blood to flow into the head. Then you have to check for ABC. Right? You have to check whether ABC is working. Then you have to immediately take to the hospital. Also, don't give anything to eat or drink to this person because sometimes they might take the person for a surgery. Right? So then they have to keep for fasting and all. So it is easy for them if you don't give anything to eat or drink. So this is what you have to do when a person is going through serious bleeding and when they are going through a state of shock. Unconsciousness. So a person can become unconscious if there is a damage to the brain, right? It could be physical damage, if there is an injury, or else if the person takes some kind of chemicals or drugs, right, poison, then also you can get unconscious. So the risk is high, right? Especially if there is no self-protection, right? And also the ABC is at high risk. Sometimes it might or might not be working. Risk of aspiration is also there, right? Because the person is fully unconscious. So the things in the stomach can come up, and since the person can't put it out, it might go into their lungs. So when it comes to children, actually, they become unconscious during fits, or else if there is a brain or a spine injury, you can become unconscious. And also if the person has taken any kind of poison or drugs also, you can get unconscious. So the thing is, an unconscious person can have a normal ABC, right? When you check for ABC, ABC is working, but the person is not responding. That means the person is unconscious. So then what are you going to do? ABC is working, person is not responding. Then what are you going to do? So now you check for ABC, right? And also you have to check whether there's any neck or spine damages, right? You have to check whether there are any neck or spine injuries. Then you have to check for other injuries, whether there are wounds, whether there is bleeding, right? You can also check for causes for this person to become unconscious, right? Whether they have taken poison, drugs, or something, you can check. And don't give anything by mouth. Don't give anything to eat or drink, right? Don't give anything by mouth because the person can aspirate. And you have to turn them into the recovery position, right? You have to turn them into the recovery position and you can transfer them to the hospital. So every 3 to 5 minutes, you have to check whether the person's ABC is working, right? This is the recovery position. So if we did the practical, we would have taught you how to change a person to the recovery position. But in whatever way you change, if they end up in this position, that is what matters. So we keep them in this position. One thing is it is a stable position. The person won't fall or they won't roll over. And the head is in a lower position, so blood flows well into the head. And also there is a less risk of aspiration. The other thing is you have to change them every 30 minutes, right? 30 minutes time you have to change the side. So if ABC is working, you and the person is not responding, you can change them into the recovery position if there are no spinal injuries. Right? So this is what you can do. Drowning. So what is the first thing you have to do when a person is drowning? The first thing you have to do is you have to rescue this person. When a person is drowning, you have to rescue them, right? You can get help from the others and you can rescue them. You can, if there is a person who knows how to swim, you can ask them to swim and rescue, or else you can use a rope, a stick. In some way, you have to rescue the person first. Then you have to check for their ABC. Most likely ABC will not be working. And then their body temperature, they will be very cold, right? And you can check for injuries, whether there are bleeding or any wounds or any kind of injuries. You can check. So the first thing is you have to take the person out of the water by using a suitable method, right? You can take them out. You have to rescue them first. Then, as soon as possible, you have to give them A, B, C. When it comes to drowning, first you have to give 5 artificial ventilations, right? First 5 artificial ventilations, then 30 chest compressions. Then you can again give 2 artificial ventilations, 30 chest compressions, 2, 30 likewise. But first you have to start with 5 artificial ventilations. And then you can protect them from cold. You can cover them. And don't waste time trying to remove the swallowed water. Because back in the days, what they did was they tried to remove the swallowed water, but this can cause aspiration. So now they don't recommend this. What you have to do is you have to rescue the person and provide ABC, right? Start with 5 artificial ventilations, then 30 chest compressions, then 2 artificial ventilations, 30 chest compressions likewise, and you can take them to the hospital. So this is what you have to do when a person is drowning. Now let's look into what we can do during a burn injury. First, you have to control the flame or the fire, right? You have to control the fire first. Then you can apply ice water, right? Cold or ice water. You can hold your hand or anything under the tap or water. You have to remove the jewelries. If the person is wearing any kind of jewelries, you have to immediately remove it, because your hand can start swelling, right? And when you are wearing jewelries, they can get stuck and they like reduce the blood flow. Then you have to cover the area with a non-sticky material, right? You can use polythene, cling films, right? Where you used to cover food, you can use those because they won't get stuck onto the burnt area. And if the person is fully conscious and if they don't have major injuries, you can give them a fluid. So first control the fire, then apply cold water, remove the jewelries immediately, and you can cover with non-sticky material. If it is a burn injury in eyes, you can wash with water, right? Like shown in this picture, wash with water. Cover the affected area. You can use some suitable material and cover the affected area. You should ask them not to move the other eye, right? Because both of the eyes work together. So you have to ask them not to move the other eye, and you can go to the hospital. So during a burn injury, this is what you have to do. Finally, let's move on to this electrocution. Now, do you know what you should do first when it comes to an electrocution? Imagine you're walking into the lab and there is a student, with a piece of wire in the hand, and they have got electrocuted. What is the first thing you're going to do? So the first thing is you should not become a second casualty, right? If you also go and touch this person, you will also get the electrical shock, right? So you have to make sure that electricity is not flowing through this person before you touch them. So you can go and off the main switch. You have a wooden stick or something, you can use it and move the person. And once there is no electricity flowing through the person, you can touch the person, right? That is the first thing you have to do. You have to make sure about your own safety. If it is something involving high voltage, you can inform the electricity board, right? And then you have to check for ABC. ABC will not be working in most of the cases. Then you will have to give CPR. While giving CPR, you will have to take them to the hospital. So remember that whatever it is, you have to make sure that you are safe, right? Especially in electrocution, make sure that the trip switch or the main switch is off before you touch this person, or else you will also get electrocuted. So this is what we have in the first part. If you have any doubts or any questions, you can ask.